Good afternoon and welcome to the sixth webinar of the TPP Hospital webinar series showcasing the modern EPR. Now, the aim of this series is to showcase how TPP is supporting the frontline digitisation requirements for NHS trusts through the SystmOne Hospital EPR, and to show how our future-proof platform has been designed to meet the changing demands, the pressures and the priorities of care delivery in the NHS. The SystmOne Hospital is an out-of-the-box and enterprise-wide system, which is comprised of the modules that you can currently see on the screen. However, these can also be taken individually. Now, today's session is going to focus specifically on theatres. So we're going to take a look at how theatres can be used to streamline clinical practice, so that, for example, clinicians can focus on providing the best possible care for their patients. So the SystmOne Theatre solution also provides advanced theatre scheduling functionality and comprehensive perioperative data record keeping, and to ensure the most effective use of available theatre time and comprehensive data capture. Now, after the session today, we do have one more webinar scheduled, which is specific to order comms. However, all of the recordings from the previous webinars are also available, and links to all of these can be found on our website. I'm now going to pass you over to our product specialist.
Yeah, hi everyone, my name's Simon. I'm one of the product specialists here at TPP, and today I'm going to be showing you the fully integrated theatres functionality within SystmOne. We've been doing a lot of development work to the theatres functionality, so this presentation will include all of the new and exciting features that have been introduced. We're going to start by looking at how patients can be booked into theatre sessions as part of an elective admission, and we'll see how the preoperative assessment can be carried out or even sent to the patient to complete themselves. We'll see how the theatre sessions are managed and created, as well as how procedures are booked, and then we'll see how anaesthesia and the surgery procedure is recorded within SystmOne, as well as how data is captured to populate the patient's medical record. Finally, we'll see how SystmOne's inbuilt reporting tools can be used. So we're going to start by viewing our patient from the waiting list. Here I can see the waiting list that the patient's been added to as part of the registration process. The waiting lists are a great way in SystmOne to manage patients that are attending for theatre procedures, as all of the booking and process can be managed directly from here. I can filter by the relevant consultant, and I can apply quick filters to find patients that share particular attributes, such as patients that can come in at short notice or that already have a TCI booked. And these filters can then be saved for future use. I can also use the search patient filter to find a particular patient within the lists. Now, from the options from the waiting list screen, I can view the patient's referral activity timeline. And this is a great tool to show me all of the key events for the patient's referral, including details of appointments, pre-admission appointments, and intended admissions. I can also view the items that are linked together, such as the waiting list entry and booked appointments. As well as this, I can view any attached documentation, such as the clinic letter produced following the pre-admission appointment, which can be viewed in the patient's shared medical record. From the waiting list screen, theatre procedures can also be booked into the available sessions, making this process easy and streamlined. I can select the responsible consultant and the date or date range that I want to make the booking, and I can then see the details of the available session. I then simply select to make the booking directly from here. From the booking screen, I can see the intended procedure that was added when the patient was added to the waiting list. Further details can be added at this stage if known, and they can be updated at a later stage, perhaps following the pre-operative assessment appointment. Completing the details, the booking can then be seen from the theatre scheduling screen, which we'll see shortly. So I'm now logged on as a nurse, and I'm going to complete the pre-operative assessment. I can access the patient's record, and I can complete the assessment using the fully customizable visualization. And visualizations are great tools to be able to easily view and record information within the patient's record. Here we can see past medical history that has been recorded as part of the SystmOne shared record, where I can simply validate the information rather than re-recording and duplicating data entry. Using these tools, we've seen our users be able to reduce these types of appointments from 45 minutes to just a handful. I can see details of investigations, previous operative history, and any allergies that the patient has recorded. The visualization allows me to update and add to the medical record by selecting one of the buttons, for example, to update the patient's allergies. Here I can add the sensitivity or allergy, and this will update it within the record. I can also access other actions from the assessment, such as viewing the patient's action group timeline. I can view all of the current and historical medication that has been prescribed for the patient, as well as the action groups that they sit in, such as viewing all the cardiovascular medication that this patient has been prescribed. Another great example of how SystmOne's shared record can be used to cut down duplication of data. As well as being able to complete the assessment from the patient record during the appointment, I can also utilize AirMid, SystmOne's patient-facing app, to push out the pre-operative assessment for the patient to complete themselves. The details of the self-assessment can then be viewed within the record prior to the appointment or prior to the procedure. I can select to send an AirMid notification with an assessment attached, with the assessment in this case being a data entry template. Recurring notifications linked to clinical reports can also be created to automate this process even further. So now looking from the patient's point of view, the patient will receive a push notification to their phone. We can see here the notification that was sent from SystmOne. The patient can then select the notification, which will take them to the assessment to complete. Here, the patient can complete the details of the assessment. The template also supports the ability to capture a digital signature for consent. The patient can select the box to record the signature, and all of the pre-operative assessment that's been recorded by the patient, including this signature, can then be viewed within the patient's medical record. We'll now look at session management and booking. So here we can see the theatre scheduling screen, and I have a complete overview of the sessions and booking that are taking place within the theatres over a given day or time period. To make the process of creating and applying sessions quicker and easier, session templates can be created and used. Here I'm going to choose to apply a session template that I pre-configured. I can filter the templates by consultant or theatre and then select the template that I'd like to apply. The details of the session are then automatically applied, but I can make any changes if required. Where a session is to be applied over multiple days, I can do this using the custom date range. Here I can select the days to apply, for example, every Thursday for the next 4 weeks. Procedures can also be booked from the scheduling screen, and I can choose to select the patient from the relevant waiting list from here, or I can search for the patient that is currently admitted. Here I can quickly select the patient by using the search function, and then I can complete the procedure booking. We're going to fill in the rest of the details, where I can select the anaesthetic type, the priority, and I can also make links between theatre bookings, which helps when cancelling or rearranging. I can then record the staff members which will be present during the procedure. I can select the staff member and their role, and doing so at this stage saves me having to do this later on when recording the surgery. I can record the details of the preference card. The items on the preference card have been automatically populated based on the type of procedure and the responsible consultant in this case, ensuring that the correct sizing for relevant equipment is appropriate for the procedure and the consultant. And when we record the surgery, the equipment can then be checked and counted. This preference card can then be printed if necessary, and items can be updated and added to at this stage if there's any additional equipment required. For current inpatients, bookings can also be made. I can select the procedure from the procedure list And as doing so, I can also add procedures to my favourites list. From here, I can also see my most frequently used procedures, and I can select from here, speeding up the booking process. Theatre bookings can easily be rearranged from the theatre scheduling screen. For example, where a patient has a latex allergy, I might want this procedure to be done first. I can use the drag and drop function to move the procedure, and any changes made like this are fully auditable against that procedure. Sessions can also be cancelled, allowing me to choose from a pre-configured list of reportable reasons. The procedure can then be scheduled to be rebooked at a later stage. And where the entire session needs to be cancelled, this can be done from the scheduling screen. Again, selecting from a reportable reason and selecting to rebook all of the procedures at a later date. Now all of the sessions can then be rebooked from the rebooking screen, where I can see all of the cancellation information as well. And as part of our recent developments to the system, we've introduced the Theatres overview screen. This allows me to see all of the book sessions and procedures as and when they are happening. I have a timeline for current time, as well as being able to see theatre sessions that run overnight and into the following day. From either the overview or the scheduling screen, I can set the theatre opening times. I can select the theatres applicable and then the days and times that they are open, which can then be clearly seen from the overview screens. I can also mark a theatre as closed, selecting the theatre, entering any details for the closure, for example for maintenance, and then the date range the theatre will be closed for. So now let's look at anaesthesia and the surgery events. When the patient has been sent for, this can be updated on the scheduling screen so that everyone can see the status of that booking. The status can then be updated when the patient arrives in reception. And all of these status changes can clearly be seen against the booking. From the patient's record, I can access the anaesthetic record, a fully customizable visualization to display information already entered in the patient's medical record, and also to quickly and easily enter data. I can access the data entry template to add and update the information in the assessment, including the category and the ASA grade, where all of this data entry items will be coded and therefore can be reported on. The patient status can then be updated and further assessments can be completed. Here we can see the default documentation that has been added automatically to the procedure on the right-click options. The documentation can be configured to quickly access data entry templates and questionnaires directly from the theatre management screens. For example, I'm going to select the WHO Surgical Safety Checklist, and this can be completed and updated at a later stage as well. I can then complete the anaesthetic room routine template, again a fully customizable template where I can review the guidance and record that the checklist has been completed. And then on to recording the surgery. So here I can record the details and events of the procedure, as well as still being able to access other data entry tools. If I've recorded the staff members at the point of booking, these can be reviewed here, and I can also add any additional staff members present, including their role. I also have the options to record the details of any hospital equipment used during the procedure. Adding the equipment ID and who the equipment was used by, I can then audit this within the system at a later stage. Whilst entering the surgery events, I can access clinical documentation to record the surgery notes into the medical record. Now we can see here that SystmOne supports integrations with digital dictation software, which can be used to populate my surgical notes easily and saves me having to type. I also have access to medical drawings, where the location of incisions, for example, can be drawn onto the body maps, or I can use a freehand grid to record my own drawings. Finally, I've got the options to upload any images or photographs to the patient's record, which can then be viewed as part of the surgery procedure. Now, SystmOne also supports the recording of continuous observations via a bedside monitor integration. When the reading is recorded by the bedside monitor, the readings populate the graph on the visualization. Here we can see this for one observation, but this can be done for multiple observations and can be graphed and grouped together. I can then clearly view that from the graph, in this case for the heart rate. And any readings that I wish to review and add to the patient's record, these can be selected and validated, and then will then show in the patient's medical record. The dates and times of the events, such as knife to skin, can be recorded, and presets of surgery events can also be configured, for example, for different procedures or theatres. During the procedure, the counts for equipment used can be recorded. The equipment counters displayed have been automatically added from the preference cards as part of the initial booking. The initial count can be recorded as well as recording any additions used, and then the final check can then be recorded. Upon completion of the surgery, the final checks of equipment are made, including recording who the checks has been carried out by, and the system clearly states any discrepancies within the checks. We're then taken back to the scheduling screen, where the patient status is automatically updated to be in recovery. And I still have access to the clinical documentation, so observations and assessments can be recorded from this screen still easily. When the patient returns to the ward, the procedure is then marked as finished. All of the details of the procedure and the surgery can be viewed from the patient's medical record, including the surgery events and timings and the equipment count checks. And to finish, we'll look at some of the dedicated reporting functions for theatres. First, we have the theatre utilisation report. Now, this is already built into the system and allows me to quickly see the use of the theatres over a period of time, with the percentage booked to what's available. Really useful for future planning and bookings. Details of cancellations are fully reportable, including where we've had to cancel a whole theatre session or just an individual theatre procedure. And SystmOne comprises a fully integrated clinical reporting suite, where customized reports on surgical events and activity can be created and run. For example, if I wanted to report on how many particular surgical events we've carried out over the last month, we can do that from here. Running the report will then show the patients who match that criteria, where I can access the patient's medical record from here, or I have access to bulk actions, where letters can be produced, communications can be sent out following their procedure, and can be sent to all of these patients in just a couple of clicks. And finally, we've seen how visualizations can be used within the patient's record, but they can also be used to display key data and KPIs from the department and displayed in areas of the hospital with the information being updated as and when future events are recorded within the system. So here we can see an example of the visualization, the maternity dashboard, including the cesarean sections within this current month. And that completes this theatres presentation. I'd just like to say thank you for watching, and we look forward to seeing you on the next webinar.